Hi everyone, welcome back to the Beauty Triangles in Clinic series. I'm so excited. I'm back at S-Thetics Clinic in Beaconsfield with the incredible Miss Sherina Balaratnam, Medical Director, founder of S-Thetics, and my go-to person often when it comes to talking about regenerative medicine, which is a lot about what we're going to talk about today. So thank you, Sherina, for having me in.
Oh, thank you very much. The honor is all mine, Francesca. Welcome back to the clinic. It's always a pleasure and honor to have you here.
Every time I come into the clinic, it feels like there's another treatment, there's another technique that you're pioneering. You're always at the very sharp end of what is scientific and new and results driven in aesthetics. So I'm really excited to pick your brains about, I guess, everything that you're seeing happen here in clinic, and also what you're doing in a very integrated way to really bring all of these incredible devices and products and technologies together, and I suppose make us feel fabulous and look fabulous and feel energized and vital for the years ahead. But maybe you can start by telling us a little bit about what it is that you're seeing here in clinic, because you have patients of all ages and stages of life passing through your door. And are there any trends that you're sort of seeing in amongst those men and women that find their way onto your couch?
You know, Francesca, I think you've hit the nail on the head with what you've just said. We see all ages and stages of life. And I think one of the key things that I'm seeing this year especially is the ages and the stages of life. And what I mean by that, I think understanding patient demographics here in Beaconsfield from a local, understanding national demographics, also very key, because I know that all of us practitioners will have patients migrating in and out of cities and counties and countries.
Yeah.
So very then important to understand international demographics as well. And that comes with bringing more patients in and traveling, as we were just discussing earlier.
Yeah.
So I think that's a really exciting part of what we get to do in our profession, especially in the regenerative and aesthetic industry. We see patients from all over the world now because the world is getting smaller. It's an honor, it's a privilege to be able to see and treat, all types of patients. And coming from an NHS background, 12 years in plastic and reconstructive surgery, I've been a doctor for 31 years now this year. I know. And I've always loved the treating of all ages, all skin types, top to toe, male to female. That's what we do in the NHS.
That full body approach.
It's in everything. And, even in plastics and reconstructive surgery, sure, we might be cutting the skin from burns or skin oncology or trauma, but you're still treating the whole system. You do need to know the cardiovascular system, the respiratory system, the endocrine system, and all of the immune status of the patient from a functional perspective, so that they heal well and they get back to society well. So in a sense, that DNA has always come into my practice. So I've always loved understanding my patient demographic here in Beaconsfield, because when you start from zero, you don't know who you're going to see, whether it's a local patient, regional, national, international, it's all the same thing. Whether you're coming in because you're concerned about your frown, whether you're worried about, skin laxity in your tummy post-pregnancy or after extreme weight loss, or whether you're concerned about facial redness, rosacea, lines and wrinkles, sagginess, puffy eyelids, everything. You have to really just go back to getting a great consultation. So going back to your question, we've kind of gone.
We've covered everything else on the journey, but no, it's fantastic.
I do this to you all the time. But coming back to your point, what are the trends that I'm seeing this year? Following the great consultation, year on year, especially from 2015 to 2019, we saw a deeper interest and, curiosity, etc. But even going back to 2015, one of the key things I saw at an early stage here at the clinic was redness. I saw facial redness in my Visia skin room next door, which, as you know, I use for all of my consultations. And I couldn't quite decide or understand maybe why everyone was so red. And that was my perception.
Yeah, exactly.
Because I could see the lines and wrinkles, I could see the puffiness and the sagginess, and I could see what needed to be revolumized. And as you know, I carry out a lot of facial injectables, and you've very kindly featured me as part of that cohort of practitioners that do that well, and I'm grateful for that. And I love carrying that out as well, but we sometimes cannot, and how I should say, shouldn't carry out facial fillers with someone with a disrupted skin barrier, which I can feel. I know what a resilient skin barrier feels like, just due to experience. And I know when the skin feels fluffy and it's not right. And when you see facial redness, telangiectasia, there's internal and external dehydration going on. And then you can find out from a patient through careful questioning that they're itchy, they're sensitive, they're sensitized to certain materials or skincare products. And where someone is then going through that, and then when they're going through a lot of stress in their life, whether it's good stress due to high performance careers, flying all over the world, or bad stress due to a grievance, for example, their cortisol levels are all over the place. And that is just an intrinsic manifestation of themselves versus an oral medicated cortisol response. So I've been asking about lifestyle behaviors beyond the UV damage, beyond the processed foods, beyond the alcohol consumption, cigarette smoking, pollution particles, all of that for 9 years plus. And I just concluded 9 years ago that our patients are just so inflamed.
I think inflammation is the root cause of so many of the things that we're battling with, disease, decay. I mean, it's such an awful word, but it is essentially what is happening to our body. And all of these things that are sometimes unexplained, like mysteries. Why is my skin flaring up? Why can't I shift this sort of bulge or whatever it might be? Why is my scalp so irritated and flaky? So much of this is caused by the inflammation initially, and the stress that's sort of building up to it. And it's interesting because so many of these things we can cover up, but you mentioned that you're seeing this on your Visio scan. And I think it goes to show the power actually of using these diagnostic devices, because something like facial redness, mainly if you're female, maybe some men as well, you will be covering that redness up probably without even realizing it with your concealer, with your tinted moisturizer, with your foundation. And we almost shy away from it and we just cover it up and pretend it's not there. And it's only when we strip it off and we look in these devices and we realize, actually, this is going on beneath the surface, and we need to really address it. We
do need to address it, and I love my Visio next door. It's like my crystal ball, because you can see through to the skin, you can see what needs to be done, and you can carry out a treatment plan, carry out the treatments in itself, and you can see, feel, and track and measure your results, and you can show the patient objectively what has happened and how we're progressing forwards. And coming back to your question about the trend. I found that 9 years ago, almost 10, inflammation, this redness that we're seeing, and I thought, well, I can't inject, and I shouldn't inject, because we're doing not just 1, 2, 3, 4 syringes of facial filler. We're doing 6, 8, 9, 10, sometimes more. And 9 years ago, I thought, well, I really shouldn't be putting this material under the skin, where the skin barrier is broken, the microbiome is compromised. Because if you inject that material under the skin, you're leaving bacteria coming through to that material itself. And with the vascular dilatation, with rosacea, with redness, you're going to be causing a serious amount of increased risk of bruising, granuloma, delayed onset nodules, etc. So 10 years ago, I thought, I think I need to shift my practice to really consider how this inflammation in the facial tissues is going to affect and influence my filler practice. As you know, I've carried out facial fillers for a long time, but I don't want to put my patients through any harm. So this is when I really thought about it. You want the skin to be in really great condition before you go in. We always talk about the facial fillers being the icing on the cake. They are.
Just, they pull everything together and they restore things, and you look in the mirror and you feel like yourself again. But
100%.
I think skin health has to be the first thing to tackle, doesn't it?
It has to be the first thing to tackle, because it's the last thing that shows symptoms and clinical signs. Inflammation takes so long to manifest, and then it gets to a point where it's almost like ground zero. It's at breaking point. So by that point, your heart's ticking a little bit faster. Your blood pressure is probably a little bit more elevated, more than usual. We just don't know, because it's a silent ticker. And we may not be at an age where we think about getting our blood pressure checked. We leave it till we get older, right? Because only older people take antihypertensive. So we don't think about it until 10 years passes. And then we're in our 50s and we think, I better get it checked. But it's a silent killer. It might affect your kidneys. It might affect your brain function. We talked about neuroplasticity at our last event. And you have to really think, the skin is the end organ. So by the time we're seeing symptoms in the skin, there's a lot more than
there's a lot more sort of that's hiding beneath the surface. So when somebody comes into your diagnostic suite, you run through all of these amazing sort of screenings and checks, and you really delve beneath the surface, and you recognize that there's information. What are the first steps when they then come into your consultation room, your treatment room, to actually start to address that?
Talk to the patient. a good consultation, 45 minutes, sometimes 60 minutes to really understand all of the lifestyle influences. I think that's really critical. Patients don't understand that where they're working, how they're working, the degree in which they've suddenly shifted into their careers, maybe a little bit too much. And interestingly, I know there'll be a lot of doctors watching that out there that maybe can also relate to this.
Yeah, of course.
We get so hungry, we get so driven, so passionate.
Performance lifestyles, and often the last people to actually take their own advice, I'm sure.
I know. So I prescribe lifestyle changes, you know, because we have to say on a scale of 0 to 10, with 0 being zero stress in my life to 10 out of 10 being this is just where I'm paced right now, score yourself. And I get every patient to score yourself. And I would say 85% plus of my patients are on an 8 to 10 out of 10. You know, and this is good stress.
Yeah, exactly.
Good stress. And how long for? Oh, you know, they can be very clear with how long that good stress is, whether it's 3 months or 6 years, etc. So if we're pacing at that level, then it means that we're adrenaled up and the cortisol is up. And that isn't even an extrinsic cortisol, it's an intrinsic measure. So I think the consultation is really what I believe in wholeheartedly, because the patient can then see it in the visio, they can hear it, they're speaking to a medical person or even as a nurse or an esthetician. And I say this to my nursing team, my esthetician team, I said, at the end of the day, we're still practicing medicine. We're treating human beings. So look, feel, touch, move. Listen first, look, which we're doing, and then feel. And you know, there's nothing better than actually feeling someone,
feeling the tissues, understanding like the quality of the skin, what's going on beneath the surface, all the anatomic structure.
Absolutely. So I stress on that to everybody. You know, touch your patients, feel for, you know, tension, tone, elasticity, feel for hydration, ask your patients how much they drink. The cup of tea is not a drink. You know, you've got to be really clear on these volumes. It's got to be really critical, because on the end of the spectrum, we're then carrying out treatments, which I love, like microneedling radiofrequency. We carry out radiofrequency every day here at the clinic, and we should know that the target for radiofrequency is water, intrinsically and extrinsically. So our patient's got to be very hydrated, 2.5 liters of water. So if your patient doesn't know that they should come to the table with that level of tanked up, then they're going to end up having a treatment.
It's a good point. I don't think anyone's ever said to me, you're booked in to have some radiofrequency microneedling. Can you please come in and ensure that you've drunk 2 liters of water before? I'd probably come in on 2 espressos and assume that it's going to have a great result. It's probably not. But I think you're right, just reinforcing those habits, those lifestyle events, and that they can be small, but you know, incrementally they will add up and they'll make a difference to all the stuff that you then get them here doing, which is what they're excited about. Absolutely.
It'll be like saying, I've got 2 Japanese aces. They're very expensive. They're a great investment. And I've got 2 choices of gardens. The first garden hasn't been looked after for about 2 to 5 years. And the next garden, the lady of the house is having parties. She's maintaining it really well.
She's feeding it, fed and watered.
Feeding it, watering, loving it, and lighting it.
Where do you want to put your tree?
Where am I going to put my tree?
So true.
That's it.
That's so interesting.
That is it.
Tell me about some of the devices that you're using here, because when we go right back to the basics and we're looking at the body as a collection of cells and we want to energize it and we want to try and tackle that inflammation, is there anything that we can do at home, anything we can do in clinic just to get that sort of kickstart and that vitality back?